Stop guessing what she secretly wants in bed. Start doing what actually works, and make both of you excited to try again tomorrow. I am Dr. Zara Vale, Urology and Men's Health, and today I am going to show you 6 playful, consensual ideas many women want to explore but are often too shy to request. We will keep everything clear, ethical, and practical, so you know exactly what to say and what to do, and why it works from a scientific point of view. Before anything, 2 ground rules. Consent is non-negotiable, and communication makes everything hotter. Do a quick check-in before you begin. Green means yes, yellow means slow, red means stop. Keep it simple, and agree on a word or a hand squeeze so either of you can pause at any time. Then build slowly. Anticipation raises dopamine and noradrenaline, which heighten focus and arousal. And research shows that when people feel safe, they respond more strongly to touch. Ask brief questions during the moment. More or less. Here or higher. Faster or slower. Those short prompts keep you connected, lower anxiety, and prevent guesswork. The first idea is using a small external vibrator together, because most women reach climax more reliably with consistent clitoral stimulation. Large studies and clinical reviews have shown that the majority of female orgasms involve the clitoral network. So steady patterned stimulation is your friend. Introduce it in a warm, relaxed tone. I brought a small vibe for us to try. Want to feel it on low while I kiss you? Start on the lowest setting over the clitoral hood, not directly on the tip at first, or even through lingerie if she prefers a gentler start. Match the power to her breath and sounds, and only increase intensity if she asks or her body leans into it. Use a water-based lubricant, because glide reduces friction and lets nerves fire in a pleasant way rather than a defensive way. Keep the toy clean with mild soap and warm water before and after. Once she climaxes, her body often becomes more responsive for a second round. Switching to your mouth, fingers, or penetration after that first release can bring a faster, more intense second orgasm. Think of the toy as a team tool. It does the steady work, while you focus on rhythm, eye contact, connection, and pacing. The second idea is sensory play with a simple blindfold. Removing sight increases attention to sound and touch, and the brain upshifts anticipation because it cannot predict where you will go next. Agree on a quick stop signal, then slow down. Explore the places that often get skipped. The backs of the knees, the sides of the ribs, the hips, the crease where thigh meets pelvis, the inner forearms, and the nape of the neck. Alternate between warm, steady palm pressure and feather-light fingertips. Describe 1 or 2 things you will do in short sentences. I am kissing the inside of your left thigh. I am moving higher. Then pause for a breath. The point is not to rush to the obvious destination. It is to ramp sensation so that when you finally shift to oral or penetration, her arousal is already high and her climax is stronger. Keep a soft towel, a bottle of water, and lubricant within arm's reach so nothing breaks the flow. The third idea is verbal arousal, often called dirty talk, though it does not have to be crude. For many women, feeling wanted and feeling seen are major drivers of desire. Start with praise and sensory play-by-play, then build intention. You look incredible from this angle. Your skin is so soft. I feel you responding when I touch you there. It feels amazing being this close to you. Then add a clear, confident promise. I am going to make you come so hard. I am kissing my way up your thighs and I am not stopping until you beg. Keep your tone warm and present. If you want to try name play or edgier phrases, talk about it outside the bedroom first. Ask, do you like being called anything in bed? Some do, some do not, and many have limits. Verbal arousal works best when it sounds sincere and connected, not rushed or mumbled. The fourth idea is controlled intensity, sometimes called rough play, done with explicit consent. Rough never means painful or pressured. It means purposeful energy with confident, controlled touch. Agree on green, yellow, red, and a stop word. Begin with firm, still touch, not sudden moves. Place your palms on her hips and hold. Guide the small of her back. Grip her waist with a steady, anchored hand. If she likes hair pulling, take a handful near the scalp and draw downward and back in a controlled line, rather than yanking the ends. If she enjoys spanking, start light and read her breath and sounds before changing pressure. Use simple leadership phrases only if she has said the language works for her. Stay right there. Good girl. Mine. Keep checking in with short questions. More or less. The goal is grounded leadership, not chaos. That can look like turning her gently and holding her wrists above her head while you kiss her neck, gripping her waist to steady her while you move, and releasing the moment she asks. The intoxicating part is the mix of decisiveness and care. When the nervous system reads safety, it allows more intensity without shutting down. The fifth idea is role play for low-tech novelty. Variety strengthens desire because the brain likes pattern change. You do not need costumes. You need a premise and buy-in. Bring it up with a smile during a calm moment. I read that role play can be fun. Want to try a simple scenario sometime? Offer 2 or 3 ideas and let her pick what feels least silly. Strangers at a hotel bar. Massage therapist and client. Boss and employee. First date do-over. Doctor and patient. Set boundaries and keep the first scene short. 10 minutes that end in laughter and great sex beat a long scene you both want to escape. Choose a start moment. We meet in the hallway. Choose an end line. When I say cut, we drop the act. Keep the language simple and your actions deliberate. If it clicks, extend it next time with a prop, a location change, or a longer arc. Novelty keeps the brain engaged, and engaged brains feel more desire. The sixth idea is pattern interrupts. If you always follow kiss oral penetration, you teach your brain to expect the same order. Break the sequence in small ways. Have a passionate quick session. Switch rooms. Try the shower. Use a different position earlier. Add a toy midstream. Change pace from slow and sensual to controlled and breathless, or the other way around. If you always start in bed, begin on the couch and move later. If you always dim the lights, try a single lamp or candle so you can see each other's eyes. If you always lead with oral, tease with warm breath and hands before you use your tongue. If you usually go rough, devote one night to slow, sensual movement and steady eye contact. If you usually go slow, devote one night to confident, controlled intensity with shorter thrusts and firm grips. Novelty does not have to be extreme. It only needs to be different enough to wake up attention. A few safety and comfort points keep everything hot and healthy. Consent and boundaries first. A 1-minute talk beforehand pays dividends later. Aftercare matters. The scene does not end at climax. Hold each other, offer water, breathe together for a minute. That settles the nervous system and makes both of you want to return to the playground you just built. Wash toys before and after. Never move from anal play back to vaginal or clitoral contact without washing or changing protection. Use plenty of lubricant, water-based or silicone, depending on your plan. Friction fights pleasure. Glide supports it. Keep tissues or a soft towel in reach. If you use blindfolds or light restraint, have a pair of safety scissors nearby. And never tie anything that can tighten on its own. If you are unsure how to introduce any of this without awkwardness, keep invitations short and kind. I want to try something fun with you. Curious about a blindfold? I brought a small toy. Want to see how it feels while I hold you? If she hesitates, pivot to something softer and try another time. If she lights up, build slowly and let her lead you deeper. If she is shy, offer gentle options. We can start very soft and stop anytime. Low power over lingerie. Feather light blindfold play. Light spanking over clothing. Narrate reassurance in short lines. You are in control. Say yellow to slow. Say red to stop. These 6 ideas work because they meet the big drivers of desire. Feeling wanted. Feeling safe. And getting variety. They also give you repeatable tools so great sex does not depend on guesswork or luck. Large surveys and clinical literature show that clear consent, clitoral-focused stimulation, and novelty are strong predictors of female orgasm and sexual satisfaction. That is why this approach is reliable and why it feels so good for both partners. Pick one idea to try next time, just one, and add it slowly. When it feels natural, choose a second. Keep consent check-ins short. Keep your tone warm. Read her cues. The goal is not to perform tricks. The goal is to build a space where both of you feel safe, seen, and intensely turned on. If you want natural support for the physical side, Research on nitric oxide shows that L-citrulline from watermelon extract can support blood flow by raising arginine levels. And there is emerging evidence that ingredients like icariin, tonkat ali, fenugreek, and nettle may support erection quality, stamina, and hormone balance in some men. These are not magic bullets, and they work best alongside sleep, exercise, and stress control. But they can be useful parts of a broader plan. Thank you for trusting me with this conversation. Try one small change, talk kindly, go slow, and enjoy what you discover together. I will see you next time.